Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about birth certificates, and my special guest is Tisha Miller, who works at the health department, actually printing out the birth certificates for folks. So Tisha, welcome. Thank you for joining us.
Thank you for having me.
Okay. Well, where can people get birth certificates? Let's start there.
Okay, people can come into the Frederick County Health Department, or they can order the birth certificates online through a website at the Baltimore Vital Records Department of Health and Mental Hygiene.
Okay. And well, what are the sorts of reasons that people need birth certificates, and why are they coming in?
They need them for many reasons. If they want to get a driver's license, if they want to get a passport, if they're going to enroll their children in school, or if now they're even requiring you to have a birth certificate for a lot of the school sports.
Okay. Well, who is allowed to then come in and get a birth certificate? Because I heard you talked about a lot of different reasons that people would need them. So who can actually come in, and who's allowed to come in and get one?
Okay, only the individual whose name is on the birth certificate, or one of their parents that's listed on the birth certificate, or if they have a representative that has a valid ID, they could come in with a notarized letter from either the individual that's named or one of their parents, and as long as it's giving them that permission to pick up the birth certificate.
Okay, well, I think you just answered my next question, which is, can family members come in and get a birth certificate for another family member? So maybe if you could repeat that again.
Okay, they can, as long as they have a notarized letter which would state that they were giving the person that's coming in permission to pick it up. And it does have to be notarized, which means it does have to have a notary, signed in front of a notary with the seal on it to prove that they, are verifying that that is the person giving them that permission.
Mm-hmm. So how about then for spouses? So say, can a husband come in and get a birth certificate for a wife, or vice versa?
Not without the notarized letter. They would have to have the notarized letter too.
Okay. Well, what do people need to bring in when they're coming to apply to get a birth certificate?
You would need to bring in a valid government-issued ID. It can be a driver's license or a passport. It cannot be expired, and it does have to have an issue date and an expiration date on it.
Okay. Well, what if people don't have a photo ID?
Then they can bring in some alternative documents. They could bring in their Social Security card. They could bring in their utility bill, a W-2, a current pay stub, bank statement, but one of them has to have the current address on it that they're currently living at, and then they would not be able to get the birth certificate that same day. That would have to be put in the mail and mailed to them, so it may take a day or two after that.
Mm-hmm. So that's another reason for people to plan. So if they don't have their photo ID, if they don't present with a photo ID, then they cannot get it that same day. Is that what I understand?
That's correct, yes. You have to have some form of identification.
So new parents, I have heard that a lot are surprised that they need to actually come in and apply for a birth certificate because they think, oh, why, they're automatically going to get one sent to them after their child's born in the hospital.
Yes. Unfortunately, Maryland does not issue birth certificates. What they do is they send out a registration notice. They would like the parents to look over the registration notice, see if there's any corrections or changes that need to be made. Then if it's fine, you can go to any health department, except for Montgomery County, to get a birth certificate. And then you would follow the same instructions to get it. They would just need their ID.
So that birth registration card is not the same as a birth certificate.
That is correct.
Okay.
That is correct. And we have a lot of people that do come in that have used that for everything, for getting passports in the past, getting their Social Security cards, putting their kids in school. But since 9/11, Homeland Security changed the restrictions and everything, and they actually want a birth certificate that says Certificate of Live Birth and has the raised seals. And the birth certificates now are on pink and blue paper, and that's typically what places are looking for.
Mm-hmm. That higher level of security or authenticity.
That's correct.
So before we close, how about if you cover the hours and location and the phone number for the health department for people to get more information?
Okay, we do birth certificates Monday through Friday from 8 a.m. to 4 p.m. We are located at 350 Montague Lane here in Frederick. You can come in entrance B as in boy. We'll be on the left-hand side, right inside the door, and you can call us with any questions at 301-600-1029, or you can go on our website at www.frederickcountymd.gov/health.
Well, very good. Okay, Tisha, I'm sure you've answered lots of questions that people have, especially the new parents. That way they won't be surprised when they find out that their birth registration card isn't acceptable documentation anymore. So thank you very much for giving us this good information.
Thank you for having me.
And now please stay tuned for this month's Medical Myth.
The Frederick County Child Advocacy Center focuses on child abuse awareness and prevention. The emphasis is on the importance of preventing child abuse and neglect. The Child Advocacy Center works to help children reach their full potential in a safe and loving environment where they can thrive, develop character, and learn to be responsive citizens. Join us in making a positive difference in the life of a child and bringing a brighter future for Frederick County. For more information, visit www.frederickcountymd.gov/CAC or call us at 301-600-1758.
Many volunteer opportunities are available on Frederick County boards and commissions. Whether the Commission on Aging, Human Relations Commission, the Solid Waste Advisory Committee, Workforce Development Board, or many others, the Board of County Commissioners welcomes your participation. Those desiring to serve must be residents and registered voters of Frederick County. For more information, contact Joyce Grissnickel at 301-600-1102 or by email at fcgboards@frederickcountymd.gov.
As you prepare your Maryland taxes this year, please consider donating to the Maryland Cancer Fund. The Maryland Cancer Fund provides cancer diagnosis and treatment services for low-income and uninsured Marylanders. So make a donation today and make a difference in hundreds of lives. For more information, contact the Health Department Cancer Screening Program at 301-600-3362 or visit our website at www.frederickcountymd.gov/cancer prevention.
The Frederick County Meals on Wheels program delivers nutritious meals to homebound seniors and others who can't shop or prepare foods on their own. Sometimes the only smiling face a senior may see during the day is that of a Meals on Wheels volunteer. With almost 100 on the waiting list, the program needs volunteers and individual donations, as well as corporate sponsorships to supplement government funding of the program. Please call the Department of Aging at 301-600-1605 or visit our website to find out how you can make a difference with your thoughtful support.
And now here's this month's Medical Myths. This month, I'll be talking about myths associated with hepatitis C infection, a viral infection in the liver. The first myth is that people can always tell that they are infected with the hepatitis C virus. Well, that is false. In fact, it is estimated that there are about 3.2 million people in the United States who have chronic hepatitis C. Most people are unaware of their infection, and each year about 17,000 Americans become infected with hepatitis C. So just because you don't have symptoms doesn't mean you aren't carrying the infection. The only way to know for sure is to get tested. The next myth is that people think that it's not a serious disease, so they don't need to worry about it. Well, that can be a deadly belief. Chronic hepatitis C is a serious disease that can result in long-term health problems, including liver damage, liver failure, and liver cancer. Approximately 12,000 people die every year from hepatitis C-related liver disease. The next myth is that the only people who need to be concerned that they may be infected are people who used intravenous drugs. Wrong again. In fact, the data is so striking when looking at the baby boomer age range, that's persons born between 1945 and 1965, that it is now recommended by the Centers for Disease Control and Prevention that all baby boomers get tested, because it turns out that many of those who tested positive when they became very ill do not even recall having had risky behavior, like just one time injecting illegal drugs in their youth and young adulthood, or other risk factors that they just don't remember, but they became infected nevertheless. So if you are a baby boomer, hepatitis C infection is something that you want to make sure you don't have, because if you do have it, it may be wrecking your liver and you don't even have symptoms. So please get tested. That's this month's Medical Myth. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. This month's health tip is brought to you by the Health Department's Maternal Child Health Program. Smoking during pregnancy is the single most preventable cause of illness and death among mothers and infants. Cigarettes contain over 4,000 harmful chemicals, 40 of which are known to cause cancer. Women who smoke during pregnancy are more likely than other women to have a miscarriage. The placenta, which supplies nutrients and oxygen to an unborn baby, can separate from the womb too early, causing dangerous bleeding. Babies can also be born too early and have a lower birth weight, making it more likely that the baby will have to stay in the hospital longer. Some babies may even die. Smoking after the baby is born is a risk for sudden infant death syndrome, more commonly known as SIDS. SIDS is the death of a baby by no immediate obvious cause. Babies who are born to mothers who smoke are more likely to have certain birth defects, like cleft lip or cleft palate. It is important to stop smoking altogether if you are pregnant or thinking about becoming pregnant. Here are some helpful tips to stay tobacco-free. Think of your reasons for quitting. Write a list for yourself and keep copies. Set a quit date. Choose the date you plan to stop smoking for good. Give yourself enough time to prepare. Develop a plan. Identify your smoking patterns and develop strategies to resist the urge to smoke. Change your routine to break the association with smoking. Avoid temptations. Throw away ashtrays, lighters, and cigarette butts in your home or car. Designate your home a non-smoking area. Avoid places known for smoking. Limit your caffeine intake. Caffeine may stimulate your urge to smoke. Stock up on oral substitutes. Keep straws, mints, sugarless gum, peppermint candy, carrot sticks, or other healthy snacks on hand for when you get the urge to smoke. Be active every day. Stay active to keep your mind off of smoking. Check with your obstetrician to see how much activity is recommended for you. When your body is active, it sends out natural chemicals that help your mood, improve circulation, and reduce your stress. Reward yourself and your baby. Set aside the money that you would spend buying cigarettes and spend it on a treat for yourself or your baby. Free resources to help smokers quit for life include the Frederick County Health Department's Stop Smoking for Life Sensation classes, the Frederick Memorial Hospital's Freedom from Smoking classes, and the Maryland Department of Health and Mental Hygiene offers free quit coaches. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.